Hey everyone, and welcome. Let's talk about Parkinsonism. Now, it's a word you've probably heard thrown around, but what does it really mean? Is it just another name for Parkinson's disease, or is there more to it? Well, in the next few minutes, we're going to clear up all that confusion. We'll break down what it is, what's actually going on in the brain, and how it's managed. So let's dive right in. So what exactly is Parkinsonism? It's the big question, right? And honestly, the answer might surprise you a little. Let's start by tackling the most important distinction first, because it's key to understanding everything else. All right, first things first, let's break down what this word even means. The best way to think about Parkinsonism isn't as one single, specific thing. Instead, picture it as a big umbrella. It's a broad category that covers a bunch of related issues. So at its heart, Parkinsonism is what doctors call a clinical syndrome. But let's ditch the jargon. It's basically a label for a very specific collection of symptoms. So when a doctor sees a patient with that particular mix of slowness, stiffness, tremors, and trouble with balance, they say, okay, this is Parkinsonism. But that's just the what. The really interesting question is, why? And this brings us to the number one source of confusion. People use Parkinsonism and Parkinson's disease like they're the same thing all the time, but they're not. Think of it this way. Parkinson's disease is a very specific diagnosis, and it just happens to be the most common cause of Parkinsonism. But other things can cause the exact same set of symptoms too, like certain medications or even damage from a stroke. So here's the key takeaway. If you have Parkinson's disease, you have Parkinsonism. But if you have Parkinsonism, it doesn't automatically mean you have Parkinson's disease. So no matter what the specific cause is, all of these different conditions have one major thing in common deep down at the neurological level. To really get why these symptoms show up, we need to peek inside the brain and talk about a really important chemical messenger called dopamine. You know, probably the best way to wrap your head around what dopamine does is with this fantastic analogy. It really is like the oil in your car's engine. Dopamine is the chemical that lets our brain send smooth, coordinated signals to our muscles. It's what keeps the whole system running efficiently without any grinding or hesitation. So if we stick with that analogy, what happens when your car runs low on oil? The engine starts to sputter and seize up, right? Well, it's pretty much the same idea in the brain. When those very specific cells that make dopamine get damaged and start to disappear, the level of this crucial oil drops. And that shortage of dopamine is what directly causes all those classic symptoms we talked about, the slowness, the stiffness, and the tremors. Okay, so we've covered the what and the why. Now, let's get really practical. What are the actual signs you should look for? Because being able to recognize them is always the very first step toward getting help. There are really four main signs to keep an eye out for. First, there's the tremor. Now, this is the one most people know, but what's unique is that it usually happens when a limb is just resting. It might even stop when you go to use it. Second is slowness of movement. This can be really subtle, making everyday tasks, like buttoning a shirt, feel incredibly slow and frustrating. Then you've got muscle stiffness, a kind of rigidity that can really limit your motion. And finally, all of this can lead to problems with balance and walking, which might look like shuffling steps and, unfortunately, a higher risk of falling. But it doesn't stop with just those big movement symptoms. The effects can be much wider. For instance, a person's speech might become really soft or monotone. Their handwriting can get tiny and cramped. There's even a name for it, micrographia. And because dopamine also plays a role in our mood and other functions, things that aren't related to movement at all, like depression or serious sleep problems, are also really common. It truly affects the whole person. Now, seeing all these challenges laid out can feel a little heavy. I get it. But, and this is a really big but, it is so important to know that there are very effective ways to manage them. So let's shift gears and talk about the pathways to treatment, because this is really where the hope and the action come in. So while we don't have a cure just yet, managing the symptoms is absolutely possible. The approach really stands on three main pillars. The foundation is usually medication, which is designed to either replace or boost the brain's dwindling supply of dopamine. Just as important, though, are therapy and exercise. Things like physical therapy are absolutely vital for keeping up strength, flexibility, and balance. And then for some people with more advanced symptoms, there are incredible options like deep brain stimulation, which is kind of like a pacemaker for the brain that can dramatically calm down those motor symptoms. Medical treatments are a huge piece of the puzzle for sure, but what you do every single day, that's the other massive piece. So for our last section, let's look at some practical, real-world advice that can help people with Parkinsonism live a really full and rewarding life. Outside of the doctor's office, it's the daily choices that can make a world of difference. Simply staying active, whether it's walking, swimming, or yoga, is a direct way to fight stiffness and help with balance. A good, balanced diet helps with energy and overall health. But maybe one of the most powerful things is connection. Joining a support group isn't just for emotional strength. It's a place to find brilliant, practical tips from people who are walking the exact same path. So let's just pull it all together. If you remember one thing, let it be this. Parkinsonism is a condition that disrupts movement because of a drop in dopamine. But the most important thing to know is that it's a condition to be managed, not a life sentence. With the right care, a mix of medicine, activity, and community, it is absolutely possible to lead a rich, active, and fulfilling life. And we'll leave you with this final thought. We know that getting treatment and support earlier leads to a much better quality of life. So just think about the power of simple awareness. Could recognizing these signs in yourself or in someone you love, and just seeking help a little bit sooner, could that genuinely change the course of a life? It's a pretty powerful idea to consider. Thanks so much for joining me.